We're here with Gilbert Darrington, the CEO of Health Services Incorporated, and it's November 5th, about 10 o'clock in the morning. We're just here to talk to them about what they're doing here and how we can potentially help out. Mr. Darrington, thank you so much for your time today.
Thank you for having us. Thank you.
I really do. So tell us a little bit about the history of Health Services and just a little bit about the history, and then we'll get going with some other questions for you.
Sure. So we were actually incorporated in 1968. We started out as a one clinic shop, as a free clinic in the basement of Montgomery City Hall, actually. And through the years, we expanded to different communities. So in Montgomery now, we have 5 different clinics and 6 clinics in the surrounding communities. So we're in Shelby County, Chilton County, Autauga County, Elmore County, Montgomery County, and Lowndes County. So over the last 52 years, we've grown from a one clinic organization to now a 15 clinic site location with 2 medical mobile units now. And we provide uncompensated care. We provide care to the medically underserved throughout all the counties that we serve. So we are FQHC, Federally Qualified Health Center. We receive a small grant from the federal government to offset the cost of uncompensated care, but we provide quality care for many, many people in the 6-county area that we serve, regardless of their ability to pay. So we see people who have Blue Cross insurance, and we see all the way through individuals who are homeless and uninsured. And so that's our motto. So we provide quality care for all of those patients throughout the 6-county area.
That's great. It's great that y'all have been able to expand, from one clinic to serving several different counties, especially
Sure.
the folks that need it the most, some of our vulnerable populations.
Yes.
As far as overall annual patient volume, I think you told me earlier that it was about 38,000.
Yes, we serve, last year we served just under 39,000 unduplicated patients. And so what that means is that one person comes in one time a year that's counted as one unduplicated patient. So out of that 39,000, they may have had 2 or 3 visits throughout the year. So we probably had over 100 to 150,000 visits last year alone. And even during the COVID, that number probably is going to increase because we're doing drive-through testing as well. So we entered an agreement with the city and Hyundai of Montgomery to provide COVID testing in Montgomery County and Lowndes County free of charge to our residents. So those numbers, including our patient visits in the clinics, probably will exceed what we did last year.
Right, right. With COVID, I understand that it's been extremely difficult for everybody, especially
Yes.
the healthcare providers.
Yes.
And I know y'all have probably seen an increase in patients that had COVID. How are y'all trying to address that with your clinics?
Yes.
In addition to your testing that you mentioned.
Yeah, so several different things. First of all, our main priority is our staff. So we try to provide our staff all the proper PPE that they need in order to maintain their safety, because they're going home to families every day. And we want to ensure that they have the masks, the gowns, the goggles, and all the stuff that they would need to be safe. But several things we've done in our clinics. First of all, everyone who comes through the doors receive a screening at the front door. And so we do a quick questionnaire and we do temperature checks on our patients. And then at this particular location, we actually have set up our medical mobile unit outside of the clinic. So if someone comes to the front door, a patient presents, and they screen out to be maybe have been contaminated or exposed to a positive person, then we could actually route them to the mobile unit for care there. Or we would, if our medical mobile unit is out, then what we try to do is get a patient directly into a patient room versus sitting in the waiting room with everyone else. And so from there, you just treat the person like you would any other person, whatever their condition they're coming in for. We do ask that people would call ahead if they know they're displaying signs and symptoms, so our team would be on the alert. But a lot of times that doesn't happen, which is fine, because we continue to preach our staff to treat everyone as if they're infected if you're taking care of them from a patient care standpoint.
Okay.
Yeah.
Okay. As far as some of the challenges that you have, given that you're a fairly qualified health center, locations, what are some of the challenges that you face, as the CEO, for your organization?
Well, there are several, and you learn how to overcome them, but there are several. Certainly, having the proper amount of PPE for each clinic it has continued to be a issue, challenging, because it's a nationwide problem. It's not just our problem. And so to try to get the proper PPE in a timely manner to all of our locations has been challenging, to ensure that all of our staff has everything they need in order to be safe. Staffing has definitely been a challenge. We have staff members who've tested positive, so they have to go and self-quarantine and receive treatment. So that leaves holes in our staff at some of the locations. As a federally qualified health center, I would say recruiting physicians is one of the hardest things about our organization that we have to do. So we've had several of our providers actually to have to be self-quarantined, and that causes a huge hole in our staffing when it comes to our providers getting out of that scheduled rotation. And so staffing supplies have been an issue. Actually, just getting the word out about what our patients need to do to protect themselves has been challenging as well. I can tell you in our Lowndes County community, where we're doing some COVID testing, we sit there and see individuals gather across the street at the Dollar General without masks and holding hands and shaking hands and those type of things. So just the education, getting the word out about what you should and what you shouldn't do during these times has been challenging in the communities that we serve.
Okay.
Yeah.
With your need for staffing, is one of the initiatives, is it potentially to employ advanced practice providers such as nurse practitioners or physician assistants in some of your clinics as well?
Yes. So in our model, for every physician that we hire, we can employ 4 nurse practitioners to collaborate with that physician. So some of our clinics are managed just by nurse practitioners with some supervision from a physician at another location. So we have a majority of nurse practitioners. So I would say we probably have 20 or 25 physicians, and then 30 or 40 nurse practitioners in the organization. Well, actually it's not that many, because I think we have around 50 total practitioners. Okay. I mean 50 total providers. So of that, probably 16 or 17 actually physicians, and the others are nurse practitioners. Okay. Yep. So that's challenging, but I can tell you even more challenging are the most important people I feel in the organization are our direct first-line caregivers, and that would be our nurses assistants and our patient account representatives who are at the front desk. They're the ones who come in contact with our patients, the most meaningful contact. When a person comes in that door, our patient account representatives could either make or break a visit. All depends on how their interaction is with a patient. And a lot of them have gone down and had to come out the rotation because of being self-quarantined. And that's where really our staffing crunches come, either with our patient account representatives or our medical assistants.
Okay.
Yeah.
Okay. You mentioned funding earlier with federal grants and things like that. Are there other funding sources that are meaningful for your organization today and potentially in the future? Yes.
One of the major challenges that we have as a healthcare organization like ours is that we have, so out of that 39,000 people that I told you we serve, 30% of those individuals are uninsured. And so when we diagnose someone with some type of issue that requires follow-up care, such as cancer. So we diagnose one of those uninsured people with cancer. It's a challenge to try to find them the specialty care and services that they need in order to treat that diagnosis. And so the funding that we receive really goes a long ways to help with those individuals. And so what we found is that we have partnerships with the River Region United Way. We have partnerships with the Lions Club. And we often go after certain grants for specific issues, Delta grants, or we've gone after a Walmart grant just to help the cost of providing follow-up care to individuals who can't otherwise receive the care, because it does us no good, or it does the patient no good, to receive this diagnosis, devastating diagnosis, but then can't do anything about it because they don't have any money to follow up or get certain medicines or different type of care that they would need to treat that diagnosis.
Okay.
So yeah, the extra grants we get are very important in providing those services.
Well, I know it's important too to detect things like that early, so that
Yes.
it doesn't get to a position where it's extremely, not cost effective, but
That's right.
it's just hard all the way around. So if we can catch it early, then it's better for the patient, but also the organization.
That's correct, and you're 100% correct. And unfortunately, our patient population that we serve, with those uninsured individuals, a lot of times they wait until they just absolutely have to be seen. The pain is so excruciating that they have to be seen. Unfortunately, we see a lot of people who have jobs, but though they have the type of jobs, so they just can't take off every day and go to a doctor's appointment, or they can't take off and get their children out of school and bring them to appointments. So a lot of times when our patients come in, they're so sick that it does require that. The stage now is going to require extensive treatment, which costs, just like you pointed out, it's going to cost more, it's going to take more time. And so, and so that education piece from us to try to get our patients in at least annually is huge for us, so they don't wait until they're either show up presenting at the emergency room, which is not where you should get your primary care, or they're in such bad conditions that we have to get them admitted and those type of things. So yes, it is challenging for the patient population that we see, in order to make sure that we're providing cost-effective care.
Okay.
Yeah.
What new initiatives do you see, and I know it's probably hard with us all dealing with COVID this year, but are there any new initiatives that your organization is planning to roll out in the next couple of years, or things that you would like to see? As a CEO, I know you're looking ahead to potentially think, who else can we serve? What other areas need us? Can you talk a little bit about what you're thinking? And again, I know it's probably hard to plan 5 years out because we are in the middle of COVID. But the next couple of years, what do you see? How do you see health services either expanding services or rolling out new initiatives? And what are some of the needs around that?
Yeah, so we actually met Monday with the management team to talk about expanding next year to Prattville. And so what I'm finding is that now individuals are finally starting to figure out who we are and what we do and the multitude of services that we provide. And so I would love nothing more than to have a clinic in most of our surrounding counties to provide care that we provide to those individuals in those areas where there is no health care. Most of the communities wouldn't be able to thrive or won't thrive if there's not health care there. I mean, health care is like the center of the hub of any thriving community. And so that's what we want to do. So in 5 years from now, I would love to be in at least 10 counties. We're in 6 now. I would like to have at least, I'd say at the end of 5 years, 4 more counties that we're providing our services to. Now the challenge to that is staffing, it's supplies, we found out in some of our communities, we find that the IT infrastructure is just not there, so they don't have access to the internet, they don't have access to different things they would need in order for us to take those services there. Even for us to go there with mobile units like we have, we find it challenging trying to get on the internet. We have an electronic health record, and so we need the internet in order to operate in some of those rural communities. The internet is either non-existent or very slow. So that is a challenge, but we try to figure out how to do that. How can we take those services? And one of the things that we start doing this year, which I think hopefully will continue to last even after this pandemic, is telehealth and telepsych. We have implemented telehealth here at all of our locations, and telepsych we have here at the home location. But it would be great to have telepsych in all of those communities and telehealth in those communities. Even for individuals, and we found that we had some individuals during the pandemic who didn't feel comfortable coming in to the clinic. So they were able to get their visits via telehealth. Now that's not optimal for some visits, but for some routine visits, it's good. And so those individuals who are in rural communities who don't have transportation, it would be wonderful to be able to provide those telehealth services ongoing, again, not just now, but ongoing. And then even during this time, we found that some individuals really need more behavioral health than was first thought. And so to be able to provide those behavioral health services through telepsych has been huge as well. So those are just a couple of things. We do want to continue to provide mobile medical services in areas where we don't have a fixed facility. So getting some footprint in those rural communities to be able to take one of our mobile vans out there, have a nurse practitioner, a nurse, and some support staff, and to be able to provide clinical visits in the communities where it's needed without them having to try to go 3 or 4 hours to one of our fixed facilities would be huge to have within the next 5 years.
Well, that's really exciting. I know that they're fortunate to have you as the head of the organization with what you're wanting to do, and I think you guys have a great future.
Thank you.
A little bit about the bus that I saw out front when we walked in.
Yes, it's brand new. Actually, it just rolled up this morning. We applied for a grant with the city. Well, if you step back a little bit, if I were to go back at March, the city approached us with a proposition to provide more COVID testing in the city of Montgomery and in Lowndes County. So the new mayor met with us, and his staff met with our staff and talked about what can you all do. And of course, we were ecstatic that they even think of us with having a Jackson and a Baptist here. But we, raised our hands. Yes, we would be more than willing to do whatever we can. So Hyundai provided some testing kits, and they provided some funding for Assurance Lab to run those test kits, so we could provide those tests for free to the public. So it took a nurse practitioner out of our rotation, took some staff members, but we normally do a health fair a year where we give back to the community. We give school supplies, we give away free screenings and those type things. Well, during the pandemic, we wasn't able to do that. So our part of giving back from what we felt was doing the drive-through testing. And so we received a lot of positive accolades for providing the drive-through testing. And as a result, we applied for a grant to do ongoing testing. The city had an idea of, well, this is not going to be something that's going to go away within the next 4 or 5 months. So let's look at what we could do long term. And they awarded us a grant, a competitive process. We were awarded a grant to purchase the brand new shiny mobile unit that we're so excited about. So the mobile unit has 2 clinical exam rooms and a dental exam room on it. You got to take a look at it when you get it after you leave. But and it's self-contained, so instead of having someone hook it up to a truck and pull it around, it's a bus. And you drive the bus up, you just drive up, you don't have to dock it or anything, just drive it up, park it, open up the doors and let the pop-outs out, and then you can see patients just like you would in a clinic. So that is going to be huge. So for the first 5 years, so starting I guess next week, we'll be able to use that just for COVID testing in Montgomery. So the agreement is for 5 years, that bus will only be used for COVID testing in the city of Montgomery. Now after that, we're hoping, or if there's a vaccine that comes out, we get everybody vaccinated, we get this pandemic under control, then we can use that to provide additional services as well, like we do with our other mobile unit now. We provide regular primary care to the community. But we're really excited about that new mobile unit.
That is really exciting.
Yes,
I
yes.
think we'll have to tour it after our interview.
Sure, please do, yes.
Well, that's all the questions I had.
Okay.
As a representative of HUB, we want to thank you for allowing us to help you guys out this fall.
Sure.
And my hope is that we will be able to continue to help you guys out and be a partner for you in the future.
Yes,
with
yes.
supply needs and some other things. We have some other ideas in some areas where we want to grow.
Okay.
And provide
Okay.
more for organizations that we work with.
Sure.
But thank you again.
Well, you're welcome, but I wanted to thank you because, again, being able to partner with organizations like yours goes a long ways to help us in our mission and what we do. And so the supplies that you've already provided for us was huge in helping us to provide care, and especially in the rural communities where we don't get a big grant just for the rural communities, and it's challenging there to get those supplies and things to them. But I just want to thank you and just let you know how, from the bottom of our heart, we are very appreciative of the gift that you gave us, and that goes directly into providing care for individuals who wouldn't have otherwise been able to get it, to receive care. And so, very huge gift, huge gesture from you and your organization, and we look forward to partnering with you going forward. So thank you so much.
Thank you.
Yes.
Thanks for the opportunity.
Okay, thank you.